Hi there, welcome to my YouTube channel, welcome to my nursing channel. My name is Nurse Master Charlie. In this video, I'm going to be sharing about blood types and their compatibility, but also a little bit about what blood is and what's in blood. So first, what is blood and what is in blood? Blood is a specialized fluid within the body that is made up of the components of plasma, red blood cells, white blood cells, and platelets. Let's break down the various components of plasma, which makes up approximately 55% of blood. Red blood cells make up 44% of blood. This can also indicate hematocrit, and our platelets make up about 1% of our blood. So where does blood come from? Red blood cells, white blood cells, and platelets all develop from blood stem cells within the bone marrow in the body. Your body makes about 2 million new red blood cells every second. Isn't that amazing? The average adult has about 10 pints of blood floating around in our circulation, which is approximately 8% of our total body weight. As a nurse, one of the things that you will probably come across is the need to administer or transfuse blood to a patient. Because did you know someone in the United States needs blood about every 2 seconds? So now that we know how much of what is in our blood and where it comes from, what does blood do and why is it so important? The body needs blood to survive and carry out many important functions, such as transporting and delivering oxygen, nutrients, glucose, cells, and antibodies, transporting carbon dioxide and other waste products. I mentioned that blood has platelets, which are instrumental in the formation of blood clots, which help to prevent excess blood loss due to injury or bleeding. Also, blood also contributes to the regulation of our body temperature. So with all that said, in order for a person to receive blood in a non-emergent situation, first, a type and cross match will need to be done. This will result in the labeling of the type of blood by using the ABO blood system, which is what this video is all about. In addition, also the RH factor, which describes the positive or negative factor of the blood, will also need to be determined, which I will go over later. The typing and cross-matching process is to determine what type of blood and RH factor the patient is and what's the best match from a donor's blood to be the safest possible for a patient to receive. This is usually done by obtaining blood or a blood sample from a patient by you as the nurse or someone authorized by your hospital or facility to draw the blood. FYI, the blood obtained for this procedure is done by using a pink-colored vacutainer tube. See my video on lab draw order. I'll put a link in the description. Through this type and cross-matching, it will be determined what blood type the patient is and what type of blood they can safely receive. We want to prevent a transfusion reaction, which can be minor such as hives and itching and a mild fever, to an acute immune hemolytic reaction, which can damage the kidneys with symptoms including fevers, chills, nausea, chest pain, lower back pain, flank pain, dark urine, to a severe anaphylactic reaction leading up to death. See my videos on the signs and symptoms of a blood transfusion reaction and the different types of transfusion reactions. So now, on to blood types. In general, there are 8 common types of blood. There are type A, type B, type AB, and type O, and their respective RH factors, whether positive or negative. This will be determined by laboratory scientists. Through the ABO blood group system, blood types are determined by the type of antigens, whether present or absent on red blood cells. Antigens on red blood cells are a type of sugar, and these antigens can trigger an immune response in the body. In a blood incompatibility, the antigen can trigger the formation of antibodies. Antibodies usually attach to antigens which are recognized as foreign substances. In a blood reaction, the antibodies attack red blood cells, or more specifically, the antigens on the red blood cells that they do not recognize. This can cause a reaction where red blood cells clump together. This is called agglutination, but more specifically, hemagglutination, which is a process of agglutination of red blood cells. This indicating that the donor blood type and the recipient blood types are incompatible. This reaction can be life-threatening, leading up to death. What does this all mean? And how does this all work? First, let's look at the ABO blood system. Then we will look at the RH factor. So what is the ABO blood system? Well, back in the day, when it was learned that people needed blood and people could be infused with blood or transfuse blood from another person, the problem with that was, at the time, some people would receive blood and would be okay, and other times, some people would die. This is why the ABO system was discovered and developed. Let's take a red blood cell, also known as a RBC or erythrocyte. Like I mentioned, on each type of RBC, there are antigens, which are basically a sugar, technically an oligosaccharide. It is these antigens, specifically their type, that give the RBC its designated blood type, such as type A, B, AB, or O. I'm going to represent these antigens as a flag. In the blood, the body creates antibodies specific to each antigen to ward off attacks. If it has antigen A, the cell is blood type A. If it has antigen B, the cell is blood type B. If it has antigens A and B, the cell is called blood type AB. If it has no antigens, the cell is blood type O, meaning none. Just an FYI, it is actually called H substance or H antigen, but for simplicity's sake, we will call it O because that goes beyond the scope of this video. Simply put, it is a system of naming red blood cells as type A, B, AB, or O. Blood groups are described according to their antigens, not their antibodies. Some additional information for you. O positive is the most common blood type. However, O negative blood is considered to be the universal donor type of blood. Blood type A positive is the second most common type of blood. Blood type AB negative is the rarest type of blood. The universal plasma donor, not universal donor, has type AB blood. So with that said, why is naming red blood cells with a letter so important? Now each red blood cell, or blood type, which is a type of antigen, whether A, B, AB, or O, will create antibodies for protection. Each type will not create antibodies against itself, such as type A does not create antibodies against itself. The same with type B, type AB, and type O. Blood type A will create antibodies against blood type B or anti-B antibodies. Blood type B will create antibodies against blood type A or anti-A antibodies. Since type AB has both antigens, it will not create antibodies against itself. In blood type O, there are no antigens on the cell, but it will then create antibodies against blood type A, blood type B, and blood type AB, or anti-A, anti-B, and anti-AB antibodies. Antibodies attack foreign antigens. Remember, again, blood groups are named according to their antigens, not their antibodies. So let's see who can receive what type of blood. Let's talk about compatibility. Here we have the RBCs with their antigens or blood types. Here we have the red blood cells with their antibodies that are made to defend against other antigens. Notice the red blood cells do not make antibodies against themselves, just other blood types. Type A blood cells create antibodies against type B blood. Type B blood cells create antibodies against type A blood. Type AB blood cells do not create antibodies against themselves because they do have both type A and type B antigens. However, type O blood, which does not have type A or type B antigens on its cell, does create antibodies against both type A and type B blood cells. Now you should know that these antibodies are in the plasma of the blood. Compatibility. So who can receive what type of blood? So can a type A blood person receive type B blood? No, because a type A blood cell has antibodies in the blood against type B blood. The B antibodies will attack the B antigen, causing agglutination or the clumping of the blood. Can a type A blood person receive type AB blood? No, because the B antibodies in the blood will attack the B antigen on the AB blood cell. Can a person with type A blood receive type O blood? Yes, because type O blood cells have no antigens. What do antibodies in the blood attack on the red blood cells? Antigens. O blood type has no antigens. Can type A blood receive itself? Type A blood. Yes. It does not have antibodies against itself. Now for type B blood. Can a type B blood person receive type A blood? No, because they have A antibodies or anti-A antibodies. Type B blood also cannot receive AB blood due to the A antibodies in the blood that will attack the A antigen on the AB blood cell. Can a person with type B blood receive type O blood? Yes, because type O blood cells have no antigen. Can type B blood receive itself type B blood? Yes, it does not have antibodies against itself. Now how about type AB blood? Can a type AB blood cell receive type A blood? Yes. Why? Because it does not have antibodies against the type A blood cell. And type AB can also receive type B blood, just as it received type A, because it does not have antibodies against the type B blood cell. And type AB blood can also receive type O blood, because type O has no antigens. And type AB blood has no anti-A, anti-B, or even anti-O antibodies. Can type AB blood receive itself? Type AB blood. Yes. Because type AB blood can receive type A, type B, and type O blood, it is known as a universal receiver or universal acceptor. It does not have antibodies against itself. Now how about type O blood? Can type O blood receive type A blood? No, because it has A antibodies. Can type O blood receive type B blood? No, because it has anti-B antibodies. Can type O blood receive type AB blood? No, because it has both A and B antibodies. Can type O blood receive type O blood? Yes, it does not have antibodies against itself. Remember, blood type O does not have A, B, or AB antigens, but it does have antibodies. So without the antigens of A, B, or AB, it can donate to type A, type B, and type AB, just not receive from those due to the antibodies against A, B, and AB. Because it can donate to type A, type B, and type AB and itself, it is known as the universal donor. Okay, so after all that, people were being infused with the correct blood type, but still a percentage of people were having reactions, even up to the point of dying. So why? To ensure that people were safe, safer, and safest, and to make blood types more specific and add a little more complexity, in addition to the A, B, AB, and O blood types, there is something called the RH blood system, or better known as the RH factor. Blood types additionally can have a positive or a negative, which means absent, RH factor. Okay, so now what about and what is this RH factor? Not only does it need to be determined the type of blood, type A, type B, type AB, or type O, but also the RH factor. This is not only important in blood transfusions, but also a pregnant woman or mother and the baby that she's carrying. And I'll briefly go over that later. So what is this RH factor? The RH factor is a short version for the word or term rhesus factor. RH is then for rhesus. The rhesus factor was discovered and named in 1940 by Dr. Karl Landsteiner and Dr. Alexander Weiner. The name rhesus is taken from the rhesus monkey. During experiments, the blood of the rhesus monkey was transfused into guinea pigs to learn why people were having allergic reactions, sometimes fatal reactions, after receiving the correct type of blood, as in A, B, AB, and O. The guinea pigs produced an immune response, a defense against the foreign substance. The rhesus's monkey blood, which was being transfused in their blood, even though it received the correct type, the ABO blood type. When human blood was tested, approximately 85% of the samples clotted, even after having the right blood type, but yet 15% did not. Thus, the rhesus factor Rh positive and Rh negative was discovered and became the second most important blood group system, in addition to the ABO blood system for humans. The Rh factor is a protein that is also found on the surface of red blood cells, along with the blood type. It is technically an antigen. If the Rh factor or protein is present on the cell, the blood type is termed Rh positive. If the Rh factor or protein is absent, the blood type is termed Rh negative. Technically, there are more than 50 Rh antigens, or Rh factors, with the most common and most immunogenic, or one that causes the most reactions, is the D antigen, which is what determines and defines the positivity or negativity of the Rh factor. It is because it is an antigen with a strong immunogenicity that an immune response can occur. You will not see blood labeled as D antigen, but you will see Rh positive or Rh negative. Let's look at this in a diagram. If a person has blood type A and they have the Rh factor present, then they are considered A positive. If a person has blood type A and they do not have the Rh factor present, then they are considered A negative. If a person has type B blood and they have an Rh factor present, then they are considered B positive. If a person has blood type B and they do not have the Rh factor present, then they are considered B negative. If a person has blood type AB and they have the Rh factor present, then they are considered AB positive. If a person has blood type AB and they do not have the Rh factor present, then they are considered AB negative. If a person has blood type O and they have the Rh factor present, then they are considered O positive. If a person has blood type O and they do not have the Rh factor present, then they are considered O negative. Did you get all that? Now let's talk about Rh compatibility. If a person is Rh positive, they have the Rh antigen. Immunologically, they do not produce antibodies against A positive Rh antigen. They are on the same team, so to speak. And since Rh negative means they do not have the Rh antigen and they do not need to make negative antibodies. If a person is Rh negative, meaning they did not produce the Rh antigen on their cells, and they meet up with another Rh negative person, again, they are also on the same team. There is no incompatibility. But if an Rh negative cell meets up with a Rh positive cell, immunologically, they do produce antibodies against a positive Rh antigen and will cause an immune response. They are not compatible. To make this plain and simple, a person that is Rh positive can receive Rh positive and Rh negative blood. A person that is Rh negative can only receive Rh negative blood. A quick review before we talk about the next section. There are 4 major blood groups determined by the presence or absence of 2 antigens, A and B, on the surface of red blood cells. In addition to the A and B antigens, there is also a protein called the RH factor, which can be either present, positive, or absent, negative, creating the 8 most common blood types: A positive, A negative, B positive, B negative, O positive, O negative, AB positive, and AB negative. Now again, the RH factor is a protein better known again as an antigen that is found on red blood cells. Again, this antigen occurs in approximately 85% of patients. Now the RH factor is not only an issue in blood transfusion, but also in pregnancy. I mentioned earlier that I would briefly discuss the RH factor in regards to pregnancy. Rhesus disease, also known as RH disease, is also called hemolytic disease of the fetus and newborn, or HDFN. This is also named after the rhesus monkey. This is a condition where antibodies in a pregnant woman's blood destroy her baby's blood cells. For example, this is where a RH negative mother has a RH positive baby. Remember, if a mother is RH positive, the mother will not have an issue if the baby has positive or negative RH factor. However, if a RH negative mother is carrying an RH positive baby, if there is cross-contamination of blood between the placenta and the mother's blood, generally this time duration can be short, such as during delivery. Then the baby is delivered without issue. However, if more than likely the baby's RH positive blood that has now entered into the mother's RH negative blood, this causes the mother's blood to create antibodies against the baby's RH positive blood. But the baby has been delivered and is safe. However, if in the next pregnancy, the mother who is still RH negative becomes pregnant with another RH positive fetus or baby, although the blood does not cross from mother to the baby or baby to mother, the antibodies that were created at the end of the first pregnancy do. These RH negative antibodies are now looking to target and destroy the fetus's positive RH factor blood. To prevent this, in the first pregnancy and after delivery, treatment with an immune globulin medication named RHOGAM will be given to prevent sensitization of the mother's immune system, or not let the RH negative mother create RH positive antibodies. To prevent this type of reaction from occurring, RHOGAM is given at 28 weeks and then again about 72 hours after delivery. It is also given with each pregnancy. Here's some RH factor algebra. If a father has RH positive blood and mother has RH negative blood, then it equals the possibility of an RH positive baby, which equals RHOGAM treatment. If a father has RH negative blood and a mother has RH negative blood, then it's possible that the baby will have RH negative blood also. That equals no treatment. Now, Rhesus disease does not harm the mother, but it can cause issues with the baby. As I mentioned, a type of passive immunity occurs due to transfer of antibodies from the mother to the placenta and to the fetus. In the case of the Rhesus factor, if a mom is RH negative and has a RH positive baby, and the mother's blood is exposed to the baby's blood, the baby will be okay. However, as I mentioned, the mother will begin to create RH positive antibodies against the RH positive blood, which will cause issues for a RH positive baby in the future pregnancies. The antibodies formed will attack the fetus's blood if no treatment is given. RH antibodies will cause agglutination and cause hemolysis of fetal red blood cells. This will lead to an array of baby issues, such as anemia due to the red blood cell destruction, leading to decreased oxygenation. This decreased oxygenation can lead to eventual cardiac decompensation or heart failure as the heart begins to overwork itself in the baby. In an attempt to compensate, the liver and spleen increase the production of red blood cells, resulting in hepatomegaly and splenomegaly. In addition, the hemolysis of red blood cells releases bilirubin, resulting in jaundice. Kernicterus can also occur, which is when excessive bilirubin is being released in the blood due to the hemolysis and is toxic to brain and neurological tissue, leading to brain damage. This results from high levels of bilirubin in the baby's blood. And also acute bilirubin encephalopathy, or ABE, can occur. Decreased production of albumin from the liver as a result of the compromised liver function will lead to decreased albumin in the circulation, leading also to edema. That is why the discovery of the RH factor and the ABO compatibility is so important and should not be taken for granted. So I hope I explained all that clearly. Now, if you learned a little something and found value in this video, please be sure to give this video a like. And if you are interested in health information and nursing related content like this, I'd like to invite you to subscribe and be part of my nursing channel. And also hit the notification bell so you can be made aware of when I release new videos. Be sure to check out my many other nursing topic related videos, as well as my nursing and health related educational music lyric videos here on YouTube. And if you want to take my nursing educational music with you on the go, my nursing songs are available for listening on almost all music streaming platforms, such as Spotify, iTunes, Apple Music, Pandora, etc. Be sure to check out my nursing blog on my website, www.nursemastercharlie.com. I'll leave links in the description. So until the next video, go save lives and make a difference in someone's life. God bless and goodbye.